Thank you for joining us today. We'll be starting very shortly. We're going to give people a few more moments to join us. We'll be back in just a moment. Thank you. Good afternoon, everyone. My name is Lisa Uris, physical therapist and regional director at SPEAR Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, and as well as welcome those who are joining for the first time. We appreciate you taking time out of your busy day to join us today. SPEAR is a private physical and occupational practice that has been around for over 20 years, with currently 20 locations located all over the New York City area. We are also proud to be awarded as the nation's top physical therapy practice by the American Physical Therapy Association. Through the COVID-19 pandemic, we have successfully continued to offer in-person care, as well as have launched SPEAR Live for those of you who are looking to stay in and receive care using our telehealth platform from your own homes. We are excited to welcome our guests today. We have two pediatricians joining us from One Medical Group, and they bring a valuable perspective to the topics we will cover. One Medical Group is a membership-based primary care practice with locations all over the city. Their family offices are kid-approved, with books and toys in their waiting rooms, a diaper changing station, and nursing rooms. They go above and beyond and offer same or next day appointments, online scheduling, 24/7 virtual care, and much more. We're really happy that they're able to join us today. We are all here for you in whichever way makes you feel most comfortable. In addition to offering virtual care in our clinics at both SPEAR and One Medical, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. We're working as a team to screen all patients, maintain distance, and ensure everyone is wearing appropriate PPE. You can find more detailed information on those safety measures by visiting our websites at spearcenter.com and onemedical.com. If you're looking for individualized care with a pediatrician or a physical or occupational therapist for either in-clinic or virtual visits, please reach out to us at your convenience and we'll get you set up for an appointment right away. SPEAR and One Medical Group have collaborated today to provide you with advice and guidance on common diagnoses and treatments for your infants from the perspective of both the pediatrician and the physical therapist. We're excited to be able to offer more education on this topic, as well as answer some of your questions at the end. As part of our session today, we will be talking through and demonstrating some exercises that you can do with your child. We welcome you to follow along and practice with us as you feel comfortable. Please note that if your infant is experiencing any pain or discomfort while performing any of these exercises, or you feel uncertain about how to do them on your own, definitely stop and reach out to us directly so we can support you. As you can see, we're coming to you live from our own homes, and although we don't anticipate any technical issues today, please be patient with us should any arise as we navigate through this technology. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find that feature, please take a moment to hover your mouse at the bottom of your screen, and you'll see a Q&A button pop up. That is where we want you to put your questions, and we'll do our best to address as many of them as we can throughout the webinar. It's best to put your questions in the Q&A feature versus the chat because we'll be monitoring the Q&A feature much more closely. For those of you who are watching through YouTube Live, we are monitoring the comment section there as well, so feel free to type your questions in there also. Lastly, there will be times where multiple panelists are on the screen at the same time. For the best viewing experience, please select the gallery view, which is at the top right of your corner of your screen, so that you can see all of us at one time on the screen. Okay, so let's talk more about what goals for the day and what we're going to be covering. Today, we're going to discuss the diagnosis and evaluation of infants with torticollis and plagiocephaly, which we will define later and give you more detail about today. We're going to demonstrate treatment options and exercises for infants to treat these conditions, as well as share helpful tips. We're going to review precautions for COVID-19 as it pertains to your infants and children. And lastly, we are going to leave time for questions and answers at the end. All right, great. So before we get started, I'd like to introduce our team of panelists and bring everybody back onto the screen now. I want to thank everybody so much for their time for today. It's very exciting to have everyone here. So we have Jason Kang, who's a physical therapist at our Union Square Clinic and the Pediatric Program Director at Spear. Hey, Jason.
Hi, Lisa.
Thank you for being here. Jason is going to help us with our content today. Also with us from Spear, we have Hannah Swaim, who is a physical therapist from our Brooklyn Heights Clinic and will be helping us with answering questions in the Q&A today. Hey, Hannah.
Hi, Lisa.
And as I said earlier, we are very excited to have two pediatricians from one medical group with us. I'd like to welcome Dr. Christina Gallus. Hey, Christina.
Hi, it's great to be here.
So Christina's been practicing since 2016 and is located at the One Medical Murray Hill office. Dr. Gallus is going to be co-presenting with Jason today. And we have Dr. Hella Baruch. Hey, Hella.
Hi, everyone.
Dr. Hella Baruch has been practicing since 2012 and is located at the One Medical Chelsea office. She's going to be helping us with the Q&A today as well. So that's our team for today. Hannah, Hella, and I are going to say goodbye for now. We're going to let Jason and Christina take it away. Thank you, guys.
Thank you, Lisa. Thank you for everyone for joining us. We're all super excited to be here. Before we get started on talking about motor development and diagnoses, we'd like to take a poll of the audience and see what you think of tummy time. So here's our question for you. How many minutes of tummy time a day is appropriate for your newborn by 2 months? 60 minutes by 2 months, 5 minutes by 2 months, 15 minutes by 2 months, and 2 hours by 2 months. I'm asking about tummy time because it really is an important thing, which we'll be covering later. Couple seconds, get you guys to see what answer we get. Adults are in, yes. So 54% of you think that 60 minutes is appropriate, and actually that is correct. So that's fantastic. All right, thank you for participating. It gives us an idea where everyone is at in terms of tummy time, which again plays a huge role in motor development. So Christina, as a PT, parents frequently ask me about motor development. Christina, as a pediatrician, what does motor development mean to you?
That's a great question, Jason, and I'm glad that we start there. So a large part of your baby's visit at the office will include discussions on developmental milestones expected for that age. And then there will be guidance on the next milestone as your child matures. A great place to start this session this evening is with a few definitions. So when we discuss or refer to motor developmental milestones, it's important to consider development of muscle groups. So gross motor is referring larger muscle groups and fine motor referring to small muscle groups. Motor delay is a term used for children who don't meet the milestones anticipated for that age based on some screening tools and guidelines. And these delays can then range in severity. So I'll go through a few common questions that we receive at the pediatrician's office. The first of being, when should you address motor delay or delayed milestones? And initially, your baby will have very frequent wellness visits with your provider, so that will allow for a full examination and discussion of milestones. But if there's a strong family history of diagnoses of motor delay, especially a genetic condition in the family, if a caretaker, another parent, a school staff mentions any concerns for development, that would be a great time to discuss with your pediatrician in between visits. Also, comparing your child to siblings can help in certain circumstances. Another time to refer is if your child is meeting certain milestones and then is starting to show regression or not doing those movements as well. A few other things to keep in mind. For babies born before 36 weeks of age, a pediatrician will guide you as to using a corrected birth age until 2 years. And also gross motor delays, so delays in the larger muscle groups, will usually present earlier than fine motor delays, so they may be diagnosed before 30 months of age. Things you can expect at your visit: while your doctor is examining your baby, they will look for tone, and that matures from head to toe. They will also evaluate for symmetry, making sure that the head is midline, making sure that the arms and legs are symmetric. And they will look at reflexes that the infant will show, especially early at birth, and some should diminish. And by diminishing or those reflexes going away, it will help to promote certain motor development. We also look for head control at all visits, starting with your first newborn visit in the office. And so now we'll go a little bit deeper into a few types of motor developments or things that can lead to motor development. And a big question we receive is, my child has been diagnosed with torticollis and or plagiocephaly. Is that something that could have been prevented? And what are the treatment recommendations? So let's start with the definition of torticollis. And torticollis means a twisted neck. So the child may be positioned looking in one direction or the other, and it can be very difficult for them to move their head. So parents can sometimes feel guilt when they're discussing baby's torticollis or plagiocephaly. The very common type of torticollis or twisted neck is due to position, and this actually can occur in pregnancy, secondary to how the baby's in the womb. So I will show you a slide now to demonstrate some of the techniques the pediatrician will use in the office. And one thing that we can use is just to do some passive cervical rotation of the head. Normal rotation for an infant would be 120 degrees, as you can see on the diagram. So for infants who have torticollis, their neck can be restrained and they will not have that full 120 degree rotation. They may have 90 degree or less. And so another common type, besides being in position or the way the baby was in the womb, can be stiffening of a muscle in the neck called the sternocleidomastoid muscle. This can also limit the rotation. In some instances, it's so significant that you can see a bulge in the neck, or your pediatrician may be able to feel or palpate it during your visit. And so again, given the frequency of these initial visits with your pediatrician, a diagnosis can be made early. And so if the treatment starts before 3 months of age, ideally 1 month of age, it can reduce the risk of complications, including something called plagiocephaly. And plagiocephaly and torticollis can be associated. What plagiocephaly is, as you can see in this next slide, is a flattening of the skull. So deformational plagiocephaly can occur from the infant laying on one side persistently or for a prolonged period of time. And this is a very common diagnosis, also for the reason that we recommend infants should be sleeping on their backs to reduce their risk of sudden infant death syndrome. There are some other causes of plagiocephaly that may require additional testing and evaluations, but we'll focus on those for now. So let's bring up our second poll. And this again is to kind of get your idea of familiarity with plagiocephaly. What percentage of infants are diagnosed with plagiocephaly? And in this question, I'm referring to single gestation pregnancy, so one child. Is it 5% of infants, 13% of infants, 25% of infants, or 40% of infants? So we'll give you a few seconds to have those answers. And so the correct answer is 13% of infants. And so I see that based on the group's response, we have a mix. So for infants that are single gestation, 13% can present with plagiocephaly, even up to 20%. When there's a twin gestation, or actually triplets, it can go above 50%. So this is something that is extremely common in our population and in our children. So the goals of treatment are mainly to help keep the head midline. This will also improve facial symmetry and vision, and it will improve the range of motion of the child. And the treatment can vary depending on the severity. So again, if it's diagnosed extremely early, there are some exercises that can be done at home, and Jason will review those, including increasing tummy time. This can start from birth with skin to skin. This will encourage your baby to lift their head and to start to move their head in different directions. The program early intervention, and again, your physical therapist can also discuss with your pediatrician or provider as soon as concerns arises what the next best step is. And once these interventions are initiated, your baby will follow up with the pediatrician pretty frequently to make sure that the development is appropriate. In rare cases, we do refer to specialists such as a neurosurgeon if we are considering severe cases that would require wearing a helmet, which is called cranial molding orthosis. These helmets have to be worn up to 23 hours a day. So again, this is generally in more severe cases or cases where therapy and treatment have not worked. So depending on this and the compliance of the therapy will determine how long the treatment is. Now that we've reviewed some of these terms and diagnoses, let's have Jason come back and join us. Jason will now demonstrate some of the techniques used in the office with your physical therapist and at home. Jason, can you tell us a little bit more about what parents should expect at their first appointment when their baby is referred?
Yes, definitely, Christina, and thank you for all that info. So let's go over what is expected when a newborn is referred to PT. So first, we're going to take a thorough history and find out what has been your child's journey since birth to now. Next, we're going to do an examination of milestones, muscle tone, and symmetry. So Christina kind of touched on this, but again, milestones are age-appropriate behaviors that we're looking to see. Next, when we talk about tone, we're looking to assess if they're activating their muscles or does the baby feel less strong, which can help dictate the overall strength of your baby. Finally, we're looking for symmetry of head position, monitoring the plagiocephaly, and that movements are being done both ways from a motor development standpoint. We then assess movements that we expect to see in your newborn. Not only are we looking at the movement, but as well as the quality of the movement. Are there any compensations? For example, a baby with torticollis may initiate rolling with their head instead of their core. We compile all this information and help create a plan to get your baby on the best possible path. We provide our thoughts and plans for the pediatrician, and with early intervention and teamwork, we'll likely be able to give your newborn the best care possible. So what is torticollis? So following up with Christina's definition, from a PT's perspective, torticollis is important to take care of, not only for the plagiocephaly or the flattening of the one side of the head or the aesthetic purpose, but most importantly, improving your motor development symmetrically. Typically, you would find your newborn bending their head towards the right, towards a certain side and rotating towards the opposite side. So what I'm going to show you right now with this doll right here is that, for example, if your baby has a right torticollis, what you'll have to find is that the baby's head will bend to the right and turn to the left. Now, because of that, there's constant pressure on the left side of the head when they're laying down is going to create that plagiocephaly or flattening on that left side of the head. All right. So how do we help torticollis? And this is where tummy time comes in. Tummy time is very important in not only reducing the flat spot, but also important in your baby's motor development. Motor development includes being able to raise your head, rolling, side lying, sitting, and so on. So being able to improve weight bearing through both sides are equally important in order to keep symmetry for all the other milestones when it comes to hopefully walking and running. So I'm going to show you a couple of exercises today to help with torticollis and other motor developments, but just quick disclaimer, this is our bread and butter, but also it's important to realize that sometimes that you might need professional help and eyesight for this, but please use your judgment during these exercises, especially if you're unsure. So the first exercise I'm going to show you is the football hold, okay? So let me just take a step back here, lower this computer. Okay, so the football hold. So again, so we're going to talk about if your baby has a right torticollis, which means if he or she has a tightness in their right side. So basically what I would do is I would place your baby on their head, placing into your right elbow. You're going to put your left arm in between their legs, give them nice support, and what you're going to do is you're going to give a little passive stretch to the baby's head. So basically what you're doing with your elbow is you're giving them a nice little stretch. You're stretching out this right side of the neck. And most babies tolerate this really, really well compared to, doing range of motion exercises like this, trying to move them that way. This is a nice way to kind of go about it. Typically when a baby has torticollis, this is kind of the preferred way for parents to kind of hold their baby, okay? The next tip I'm going to give you is all about feeding, actually. So whether you're doing breastfeeding or bottle feeding, what I typically recommend is for when you're utilizing the time to kind of help facilitate range of motion. So If a baby has a right torticollis, again, you'll find that they might be limited to the right side, turning their head to the right. So maybe you can take this opportunity to either position the baby, if you're feeding on a pillow or breastfeeding, that they will turn their head to the right as much as possible when you're facilitating that feeding. Now, a disclaimer again is that I'm not saying don't feed your baby if they don't turn to the right, but try and see if you can make that happen for yourself, okay? Now I'm gonna grab this computer. In 1 second, we're gonna go on the floor. All right, perfect. Okay, so next one I'm gonna show you is basically a way to help initiate rolling. So an issue with torticollis is that because babies tend to look one way, they tend to roll that way or do a lot more activities to that direction. So our goal as clinicians to help make sure that symmetry is happening both ways. So rolling, sitting, weight bearing, all those activities. So a good way to kind of help facilitate that is through playtime, which is really important. So what we're going to do, I'm sorry, quickly, on my toy right here. So what I'm going to do is we're going to kind of side lie. I'm going to use my leg to help support, or if you wanted to lay down, you can use your arm to help support your newborn and be on this floor. And what you can use a toy, you can use sound, you can use any sort of visual or stimulus, cueing, any stimulus. For example, with this toy, I'm going to get the baby to try to reach for the toy, and hopefully he or she will grab it. And you can use this, or you can use your hand or your finger, and it will reach, and then you can help facilitate this rolling. And so this is a way to kind of help get symmetry. And you'll do both ways. So now I'll switch to the other side, and we can kind of get them to roll both ways. So again, this is a quick way to kind of help have fun, as well as get them to start rolling both ways. And then finally, tummy time, we're going to talk about tummy time. So tummy time, again, is really important in developing your neck muscles. You'll find that with torticollis, a baby will have weaker muscles on the side that's tight, actually, compared to the other side that's being used all the time. So what we want to do is help facilitate neck strength. Now, tummy time is actually really hard for babies. So that's why sometimes a baby, when they're laying on their stomach, might tolerate a couple seconds. So a way to do that is progressing them into a full tummy time. So a neat way to do this is that I like to do is, I'm going to raise this up, is actually I'm going to put them on my knee, all right? So by doing this, it's going to help create less tension or less gravity to push down their head. So by doing this, you can help improve the endurance of their tummy time and quality of their tummy time compared to just letting them lay flat like this, laying flat on the floor, okay? Now, I'm going to be giving you a handout later so that if you have any questions about these exercises, I can help provide that information for you again. So I hope these exercises and tips were helpful for you and that you now know more about what you can do at home. So next, Christina and I like to spend some time going through some common FAQs that we've gotten in relation to COVID-19. So let's bring Dr. Gallus back so we can give you some guidance on this.
Thank you, Jason. Those were great exercises for parents to try at home, and that's something that you'll reinforce at your visits. We are being asked a lot about COVID, so I wanted to make sure that we allow some time to discuss some of those frequent questions before we get to a few of your questions. And so the big one is exposure to COVID in the office. And so many parents have asked, do I need to come into the office for my infant or child's visit, or do I need to go in the office of a physical therapist for therapy? So I'll discuss a little bit on my end. Part of the physical exam is not only looking at your baby's milestones and development. We do have to use some screening tests that can only be done in person. Again, hands-on physical exam is also extremely important. And some visits are associated with blood work that's needed and immunization. So those are things that we want to make sure are still being done on time. I can assure you both One Medical and Spear have put a lot of safety practices in place to protect you. So I'll let Jason talk a little bit about his guidance as to coming into the Spear office.
Yes, so with torticollis or any kind of motor development, at this point, it really is case by case. We'll go through, if it allows it, we'll go through a telehealth eval, and based on what I can ascertain from the eval, we can kind of see, hey, this baby would benefit from not coming into the office, or this baby would benefit from doing telehealth. But ultimately, we hold us all CDC standards for our babies so that they are able to come if they needed to.
Thank you, Jason. And so a few things that we all do to help reduce the risk of infection are to practice hand hygiene, which is washing your hands at least 20 seconds, preferably with soap, but you can use a hand sanitizer. And the hand sanitizers that are recommended should have at least 60% ethanol. The second thing is to encourage the use of masks, especially when indoors. And we do recommend this for children age of 2 and older. Lastly, social distancing is still extremely important, and so it's something that we want to reinforce for our children as well. A few things to cover in terms of COVID testing. At One Medical, we are offering COVID testing at our offices and some locations off-site, and there are a couple of types that we're using currently. We do have the COVID PCR test. The way that we perform this test is by using a small Q-tip and we rotate it in each nostril for about 10 seconds. So this should not be painful for children. It can be done for children of any age. And most of them will say that it tickles or that it's slightly uncomfortable. And so there's a number of reasons why children should be tested. A few of them can be concerns for recent exposure, requirement for school, or of course, if there's symptoms concerning for COVID, we do recommend the PCR test. In certain cases, we are asked about antibody testing. And this is ideally done about 2 to 3 weeks after a suspected exposure. We are not doing antibody tests as frequently now because the PCR test is more important in knowing recent exposure if you've had symptoms. Lastly, another reason for antibody test would be if you are deciding to donate any plasma, and that's generally something more for older teens and adults at this time. So I want to emphasize one other thing in regards to COVID is that we don't have a vaccine specifically for that, but we are offering the influenza vaccines and the Tdap vaccines for parents. So we want to make sure that all those who will be around your infant or child are up to date in vaccines if they can be. And the big ones this season would be the influenza vaccine and the Tdap, which is the pertussis vaccine. Infants are extremely high risk for COVID, and sometimes if you have one infection, they are at risk for a co-infection, meaning having a second one. So we want to do everything we can to help reduce that risk. And Jason, maybe you can tell us a little bit more about coming to the office if there's concerns for COVID exposure and some things that they can practice.
Yes, thank you, Christina. Yeah, so I do want to note that COVID should not delay in office appointments for your children, as the diagnosis and therapies we discussed are time sensitive, and any concerns should be addressed early in your child's development. The quicker we get it, the easier it is to help their development, and the harder it is after about 6 months to kind of even do tummy time or head extensions and rolling. It is a little bit more difficult. At Spear and One Medical, we are going above and beyond to ensure a safe environment, and we're here to help when you need us. That's all we have for now. But we bring Lisa back so we can answer some of the questions that you all have.
Hey guys, thank you so much for all of that info. That was so helpful. I have a whole bunch of questions for you, so I'll throw it out there. We have a lot of questions about like torticollis and plagiocephaly and just some clarifying questions. But first, tummy time. I think the question came in, when should I start tummy time with my child? And then when I am doing tummy time, is there a better time of day to do it? What do you guys think?
Yeah, I'll start off if you don't mind, Christina. So yeah, I would start tummy time as soon as possible. And I think a great way of doing tummy time is, I'm not a parent yet, but all my experience with working with parents, it is really important just to have that skin to skin contact. And a great way of kind of doing that is by placing them close to your chest, maybe on your back, and kind of having that contact. Again, the ultimate goal for tummy time is 60 minutes by 2 months, but chances are your newborn won't be able to tolerate even a couple of seconds, but it is important to do right away. I would definitely recommend to do it before you feed. Chances are they will, spit up their milk and things along those lines, but I would start as soon as possible and to their tolerance.
Yeah, and Jason, I completely agree with that. So we recommend the same thing. Let's start right at birth. And so the skin to skin is probably one of the most important things that parents can do with their infants. And that helps promote that head movement, the neck strengthening, and then helps to reduce some of the flattening of the head. We are still encouraging that anytime an infant is asleep, that they're on the back, especially if the guardians are also asleep. So we want to promote the tummy time or the skin to skin when the infant is awake so that they can participate. And generally after a few weeks of life, they tend to be awake a little bit more towards the morning. So before feeding in the morning would be a great time to have a session. There are a few tricks that you can use to help your child participate in tummy time as they get a little bit older and they start to fight you. And that really depends on the age of the infant. So if we can make it fun and engaging and have some toys for distraction or some noise or lights, that would be a great thing to use to your advantage.
Awesome. Christina, you jumped into my next question, which was like, what if my infant or toddler refuses to do it? I guess, do you have any other tips for how to facilitate tummy time if they were really having a difficult time?
Yeah, and so the length of the tummy time sessions can be as short as your child allows you. So if they're uncomfortable or seem to be in pain or hungry, you can absolutely stop the tummy time and address their needs and then pick up later during the day. So the amount of time that we generally want by 2 months is 60 minutes, but again, that can be broken up in different sessions. And so we like to recommend using things that are already in the home that your child is stimulated by. So definitely your face or whoever else is around, if there's siblings, if there's pets, that's something that distracts them. So we want to make sure that you get to their eye level if they're laying on the ground and you're doing tummy time there, or if they're on your chest to make sure that you're trying to make eye contact. Colorful toys are also helpful for older infants. So you want to use something that makes noise, that has lights or plays music to help distract them. And lastly, if you're able to go outdoors with your infant, especially to a park area where you can safely distance, you can lay out a blanket or a towel on the ground and use those distractions of nature to help entertain your child while you're trying to promote the tummy time.
That's a great idea, actually. The sounds above, right? Get their head up. That's awesome. So another question that came in, aside from tummy time, is should I be concerned if my baby's head is misshapen?
Yeah, and so that's a great question, and I'm glad that you bring it up. And that's something that pediatricians definitely want to hear about if it's not addressed during a visit. And so we have seen that infants have, some of them have fallen off their schedule of visits. And so I definitely recommend that you have that discussion with your pediatrician. If it's not severe, it's something that can be easily addressed through physical therapy, at least initially, to see what the development is. It should not affect your child's overall development, though. So again, if it's addressed early, there are some therapies that we can try before they're referred to a specialist. So I would say the sooner you can contact your pediatrician, the sooner we can put together a therapy session and put together some guidance and follow-up for you and your child.
Awesome. What about like helmets? I know you mentioned, Christine, I think you mentioned helmets. What about, like, do you recommend helmets? What do you recommend when it comes to helmets? Are they necessary? Can you talk to us more about that, maybe from both perspectives?
Yeah, and so I know that that's a big question that we get asked a lot, and really it's up to your pediatrician or your provider. A specialist is usually involved if there is a discussion about helmets for your child, and then of course the family. So helmets can be pretty tedious to have in that they are required to be worn for a long period of time, sometimes 23 hours a day. That can be very difficult for your infant. So we really try to do a few things. One, again, is that early diagnosis, so bringing up any concerns that you have. Second is to promote physical therapy sessions ahead of time and to have very close follow-up. Those three things can sometimes result in you not needing to have the discussion of helmets. There are some circumstances, though, where if it's not a common reason for the plagiocephaly or the flattening, or your child's head size is affected, or the symmetry of the face is affected by the plagiocephaly, those circumstances, we would absolutely have a specialist involved to discuss the helmet. So your pediatrician may not recommend a specific brand of helmet, but they will let you know if your child has such severity in the plagiocephaly that this is the time for that to be addressed. Specialists will usually have a little bit more in-depth conversation about you, your family, your infant, and again, their age, to see if a helmet is appropriate or if we still have some more time to do the home therapies and the physical therapy.
Right.
Yeah, I totally agree. Just from a PT perspective with helmets, helmets are heavy for a newborn, right? Even tummy time's importance is to kind of help develop neck extension, and with helmets, they sort of make it harder for neck extensions, and babies tend to develop compensations with the use of helmet. So what I tend to like to promote just from my, as a PT, is to promote getting stronger so that the babies, as the baby gets stronger, they don't stay on one side to keep putting the pressure on that one side of their head to keep making that plagiocephaly worse. So if we're able to kind of get them to roll and start moving their head better, then chances are that there'll be less pressure of that plagiocephaly and improve that, and hopefully a less chance of getting a helmet based on the pediatrician.
Awesome. Another question came in kind of similar, like about pillows and plagiocephaly. Do you guys have any recommendations with pillows?
Yeah, and that's another great question, Lisa. I'm glad someone had brought it up. So a few things. One is that we do recommend that infants sleep on their back in a crib without any toys or pillows to protect them or reduce their risk of sudden infant death syndrome. And so it gets a little bit tricky with regards to pillow use in infants. Ideally, you don't want to have anything in the crib, including a pillow that's advertised as one that can help with your child's head shape and development. So we don't recommend those at this time. Now, during the day, if you're awake, or your partner, whoever is taking care of the child, is watching the child, you can use that for help and support, at least until the child learns to roll. So as Jason mentioned, once they're rolling on their own and spending a lot of time on their tummy, the risk or the severity of plagiocephaly will decrease. And so we start to discuss other therapies first before we recommend something like a daytime use of a pillow.
Makes sense. Another question, maybe in general, like should my infant be demonstrating a dominant side, and if so, by when?
Yeah, so infants should not demonstrate a dominant side. And so they should not, especially hand preference. That's something that we generally don't want to see, at least until 12 months or later. So as they start to grow and develop, the big thing that we look for always is symmetry, both in the activities that they can do. So we want to make sure what they can do with their right, they can do with their left side, both for arms and legs. But we also look for muscle development. So if we see that one side is being used a little bit more than the other, you can start to find some signs on the body in terms of their muscles and their movement that will show us that. And Jason, this is probably something that you see as well for the younger infants that have some limited mobility.
Yes, yeah, 100%. We don't want to see a dominant side until at least until later on. We definitely want to focus on getting both sides as symmetrical as possible to, again, ensure that when they're developing motor-wise, they're utilizing both sides, so everything's equal or walking, make sure they're able to put weight both ways. So I totally.
Yeah.
Jason, what would you recommend? I guess briefly, that people can do to make sure that the infants are using both sides.
Yeah, so it's simply as just making sure that when you are playing, that the toys aren't just on one side, right? Toys are you're making sure that you're putting the left side and right side, making sure that when practicing rolling and when you're sitting, that everything is done both ways. It's just a great way to kind of make sure that you're hitting both ends.
Last question on plagiocephaly and torticollis. The question is what are the long-term effects of being diagnosed with one of these? And will the baby be normal? What is your take on like the long-term effects of it?
Yeah, so Lisa, that really depends on what is causing the plagiocephaly or the torticollis, and that's something that will require an evaluation again by your pediatrician. If it's a common reason, deformational plagiocephaly, again, just from laying and putting pressure on that side, that should not affect your child's long-term development, especially if it's addressed early. If there are other conditions that are causing the plagiocephaly, especially again, if it's something genetic or associated with other signs or symptoms for your child, that can affect it. So that's a discussion that should be had with your pediatrician and provider. It's really on case by case, but the more common type should not affect your child's development. If they do have limited mobility, so again, because of torticollis, they're not able to move their head side to side, and because of plagiocephaly, they can have some asymmetry to the face, that can affect their next step in motor development. So you may start to notice that they're not meeting the next milestone because of that. And once therapy starts, we do see these infants catch up. So long-term, it should not. I want to just mention something that parents can use. So I would recommend taking videos of some of the activities that your infant and your child is doing at home may be a little bit hard to replicate in an office, but especially if we're concerned for your child showing a dominant side or having difficulty with certain movements, taking a video and bringing that to your pediatrician's office or uploading it into your child's chart may help start that conversation and address specifics of it.
That's a great recommendation. Thank you for that. That's awesome. Another question came in. Do you have any suggestions for helping a child who's maybe a little bit older, 20 months old, that has low muscle tone and not walking yet? Is there any suggestions there? Maybe from both of you, Jason, definitely from the rehab side.
Yes. Yeah. There. So there's definitely a window that we like to give for any sort of milestone. First off, but usually a baby with low tone, we definitely want to facilitate their ability to activate their muscles to help facilitate that ability for them to stand. So we're probably, if they're not walking by 20 months, what we would want to do is make sure first see if there's, talk to a pediatrician, see if there's a genetic reason or things along those lines, but if it's a purely low muscle tone issue, what we want to do is get them to start firing their core muscles, get them to start utilizing the correct muscles to help facilitate them to start standing up. And from standing up, we'll start doing walking together and then start independent walking. So it's a process, a step-by-step process, but we can definitely work on that. Simple.
I agree with you, Jason, with that. That's a great point. So first and foremost, we want to make sure that there's no other reason for this delayed milestone. So not walking by 20 months would be considered that. And again, if it's just the low tone, that's something that physical therapy is great in that it can work really well and just start to help use those muscles. But if there are other reasons for the delay in walking, that's something that your pediatrician can start doing a workup for and addressing. So I would definitely recommend getting in touch with myself or Hella or your pediatrician so that we can discuss this further.
Great. So kind of shifting gears a little bit, a question came in about what is your best advice to keep babies healthy during the pandemic?
So we've covered a few of those things, especially now with school starting. We want to make sure that we're practicing those safety guidelines, especially the mask wearing and the hand sanitizing. So that I would say is definitely extremely important to have on the list. And second is to vaccinate all household members or whoever's involved in your infant or child's care. If they're able to receive the vaccines, most pharmacies and offices now have them available. So flu shot and Tdap should be given. And outside of those guidelines, it really depends on each family's risk factors, so who's coming into the home and who's leaving the home. A few other practices you can do is whoever's coming into the home from outside should shower and try to undress and leave everything that has been potentially exposed at the door and change. And so that way you can minimize bringing it into the home. A second thing would be not to take your infant or young child out to enclosed public places, as that can also increase their risk. And lastly, we do recommend that infants and children receive all their other immunizations as well, as that can reduce the risk of infections, which we tend to see either seasonally or when school starts. And these infections can be spread pretty quickly from one child to another.
Great, thank you so much, Christina. That was really helpful. Last question that came in more specifically to PT, Jason, was whether a telehealth visit is sufficient for PT for an assessment of the infant, or if in-person is better, and what you would recommend if someone was looking to come for care.
Yeah, so honestly, at this point with COVID, my first recommendation would be through telehealth, just kind of get a gauge of what exactly is going on. Obviously, with the telehealth eval, what I would do is I would go through various movements, and the parents would help me, and I'll utilize, and our PTs, all of our PTs and OTs will utilize some sort of doll or something like that to kind of help the parent with the evaluation, so we can kind of get an idea of how they're moving, what's going on, and that can give us a gauge of the severity of what we're looking for. And if the advice and exercises that we provide through our exercise program is not helping, then yes, 100% we'll be like, yes, come on in. We're following CDC standards, and we're going to kind of work together to help facilitate the training program. That's it.
Very cool. Awesome. So you'll basically guide them when it's appropriate to come in. If you think right away, then you'll tell them.
Exactly. Yeah.
Cool. All right, great. Thank you guys so much. Your answers were so thorough and so helpful. Honestly, I've learned a ton already and about infant care. So this is really helpful. We hope that today's talk was really valuable for all of you and that you learned more about common pediatric diagnoses and their treatments, as well as more about precautions related to COVID, which I feel like Christina, you did a great job covering that as well. If we didn't get to your questions, we will do our best to reach out to you directly afterward. We're also going to be sending out a handout of important facts and our contact info that of everything we covered. So you'll have all of that as a reference also. I want to give a huge thank you to our team today for your time and expertise. As a reminder, our presenters for today were Jason Kang, a physical therapist at our Union Square office and Spears Pediatric Program Director, as well as Dr. Christina Gallus, a pediatrician from One Medical Group at the Murray Hill office. Their contact info is provided here, so feel free to jot it down so you can reach out to them and if you have any questions or to schedule an appointment. Our Q&A moderators today were Hannah Swain, a physical therapist at our Brooklyn Heights office, specializing in pediatrics, and Dr. Hetler Baruch, excuse me, a pediatrician from the One Medical Group at the Chelsea office. They were a huge help in answering your questions today. Please take down their contact information as well so they can be a resource for you if you have any questions or if you'd like to see them in their office. Lastly, I'm Lisa Yurst, one of the regional directors at SPEAR. This is also my contact info, and I'd be happy to answer any questions you have and or facilitate getting you set up with an appointment with one of our great therapists or doctors. I want to give a special thank you to our guest from One Medical Group. Dr. Gallus is an empathetic and compassionate pediatrician, and she uses a family-centered approach with an emphasis on education and preventative health. Dr. Baruch, who is a parent herself, believes in building strong relationships with parents to support them through their parenting journey and foster optimal health and development with their children. At SPEAR, we connect with these values a lot, and we thank them so much again for joining us today. At SPEAR and One Medical, we treat an array of conditions from head to toe, and we're available for in-person visits as well as for telehealth sessions in all of our clinics, which we both have located throughout the city. One Medical Group is also currently running a promotion where you get 1 month free, so please use the code here to apply for that. Should you feel that your child or you could benefit from individualized guidance and treatment, please don't hesitate to reach out to us, any one of us individually, and we'll personally help you get set up for an appointment and an evaluation. Lastly, we're very excited to announce that SPEAR will be hosting a webinar like this every Thursday evening at 5 p.m. for the rest of the year, covering a variety of topics. So we look forward to seeing you there. Thank you all very much for spending time with us today. We hope you enjoyed our webinar and we wish you all the best. Thank you all. Have a good one.
Thank you.